Hello dear students, today we are going to discuss about ward round, and I think it is very common that is thing for you students, and as a pharmacy student you all should know what is ward round. And I think whenever you went to one hospital that for OPD and you have seen that the doctor is not in its cabin, right, and somebody will say that he is on round, right. And whenever you will some of your friends or some of your family members in hospital, that means in a hospital means he or she has been hospitalized and you will go to meet him or her. You have, I think you have found that the doctor came and he or she will observe the patient, your family member, and they that means write something and they will ask and they will get the feedback from the patient or his or her attendant. So, all these are the aspect of ward round, right. All these are the ward round, that is you may say activity, and where the doctors with nurse, it may be the nurse, it may be the pharmacist, it may be the assistant doctor, they will come to observe the condition and the improvement of the patient, right. And repeatedly I am saying you the main target of pharmacy practice is the main patient care, right. So, here we are now going to discuss about all these aspects. Okay. So, what is ward round? We should know, that means what is the perfect meaning, perfect definition of ward round, right. First let us know about the definition of ward round. A ward round is a visit made by a medical practitioner alone or with a team of health professionals and medical students to hospital inpatients as their bedside, right, to review and follow up progress in their health. So, that is the main purpose of this ward round, to review and follow up the progress of their health, how it is improving, how the that means health status of the patient is improving, how it is coming out of that particular disease condition, right. So, for that the ward round is there, which is by a medical practitioner alone or with a team, right, and this team may that means it may include whom, the health professionals and the medical students, right, and at least one ward round is conducted every day, right, to review the progress of each patient, right. However, more than one ward round is not uncommon. That means sometimes it happens that one doctor will come, then next to that another doctor will come, and next to that the pharmacist will come. So, this ward round one must be there, the number of ward rounds must be one, or it may be more than one, right. So, it is all because of the target is the focus is the patient care and the improvement of the patient health status, right. So, addition of pharmacy practitioner in ward rounds helps to ensure what are the other aspects, what are the other advantages, safe, effective and economic use of the drugs, right, which ultimately results in the decrease in adverse events, improving the patient care, right, reduced length of hospital stay and reduce the healthcare cost, right. So, the pharmacist that is mainly it is participating with this ward round. Why we are knowing this ward round? Because the pharmacist has the great role in this ward round. He or she, that pharmacist ward round, it helps to ensure what is there any safety issues, that means is there any adverse effect is occurring. I think you all know adverse effect, right. It is not new word to you all. Adverse effects means the untoward effect of one medication which has been given to the patient, right. So, the pharmacist, it is observing this condition, that means whether any adverse effect is occurring with that medication or not, that is for the safety of the patient, right, and whether the potency, whether the effectiveness of the medication is there or not. That means, the pharmacist has to ensure the safety, effectiveness and economic use. If the drug is of that means 100 rupees per tablet and it is also available in 10 rupees per tablet, that means the pharmacist has to ensure it is of cost, that means economic or not, right. So, all these things are the roles of pharmacist in this word round, right, for safety, for effectiveness and for economic use. So, that he will communicate to the physician and the high authority, and whatever the patient care improvement is required, or if there is any kind of adverse effect that has to be reduced or decreased, he or she will take care of it, right, and reduce the length of the hospitalization is also added to one aspect of this word round by the pharmacist, right, and reduce the healthcare cost, because it is also estimating the economic use of that medication for that particular patient, right. So, next thing is what are the goals of this word round? As we are discussing word round, we should know what are the goals, right. So, the goal of word round is to closely monitor the patient's condition and take immediate intervention to improve the patient condition and avoid death, right. This is the main target. The patient is in the hospital means it has to be in better condition, it has to be come out from the disease condition. We have to avoid death. So, that is the main purpose. So, that is the main goal of word round. That means, sometimes you have seen that doctor will come and he will that is take history, he will take look into the history of that patient and what are the medications he or she is taking and what is the improvement. If it is not improving, then he will change the drug. If he is improving, he will reduce the dose. Likewise, it will be there for depending on the patient condition improvement, and the target is to avoid death, right. The doctors visit all the patients admitted in their unit in an order beginning from the intensive care unit, right. The doctors will not only go to the ICU, that is he will start from ICU obviously, because the patients are in need, they are in that is critical condition, right. So, the doctor visit all the patient admitted in their unit in an order beginning from where, that is intensive care unit, right. And here also there is documented case reports to remind the case history of the patients, who quickly updates and is able to change the strategies of the treatment. If there will be any change in the strategies of the treatment, that also to be noticed, right. So, here in word round, one goal is there is documented case reports to remind the case, okay, remind the case history. They will go through, the doctors will go through the case reports to remind the case history of the patients, who quickly updates, who, that means the by observing these case reports and is able to change the strategies of the treatment. So, it will be useful, right. And next thing is that, so now you knew about the goals, right. Next is about the objectives. So, what are the objectives of this medication word round? To gain an improved understanding of patients' clinical status and progress and current planned investigations and therapeutic goals, right. So, this is the main objective. I think you can all understand from all these that is discussion. I think it is now clear to you all, that is what are the objectives, that is to gain an improved understanding of the patient's clinical status, right, and what is the progress and current planned investigations, whether there is any kind of investigation to be done, any biochemical test, any hematological test, and the therapeutic goals. So, this is one objective, and another objective is provide relevant information on various aspects of patient's drug therapy. So, it will provide relevant information. It will provide one information, second information, third information. So, relevant informations on various aspects of patient's drug therapy, such as pharmacology, pharmacokinetics, drug availability, cost, that is how much it is economic, and drug interactions and adverse drug reactions. All these are very much important to get into account during the word round. It is one main objective, right? It is the second objective, but it is also important to provide, it is word round is to provide relevant information on various aspects of patient's drug therapy, such as pharmacology, pharmacokinetic, drug availability, cost of the drug, drug interaction, whether the patient is taking 2 or more drugs and whether there is a chance of drug interaction, it has to be analyzed, and any adverse drug reactions. Then next is the third objective, optimize therapeutic management by influencing drug therapy selection, implementation and monitoring and follow up. All these things are the objectives of medication word round, right. So, next we are going towards the Indian scenario of medication word round, right. So, it is also important to know, because we are staying in India and we all are well known to the Indian hospital, that is what are the types of hospitals and what are the what are the things going on in the Indian hospitals. So, let us know about it, right. So, this medication word round, the primary care clinics, I think you know that the nursery and the clinics where that only doctor will go for the ward round, that is the primary care clinics, and primary care hospital where that means one that is patient with that means one doctor will come with the nurse and pharmacist. So, that is the primary care hospital. One is clinic, next is the hospital, then next is the secondary care hospitals. That means, it will along with other facilities, right. The hospital along with other facility, and tertiary care hospital where the multidimensional that is that means verification, and there will be multidimensional diagnosis, all these things, and multidimensional, that means there will be gynecology department, there will be other departments likewise. Okay. So, multidimensional, if it is multidimensional, that it will come under tertiary care hospital, right. So, depending on that, the word round, the medication word round will be like this. Okay. So, let us now know about the classifications of medication word round. So, it is very simple, pre-round, then registrar or resident round, third one is the professor or unit chief rounds, and the fourth one is teaching rounds, right. 4 are there. What are those? Pre-rounds, registrar or resident rounds, listen carefully, right, professor or unit chief rounds, and the teaching rounds. So, these 4 are there. So, let us know one by one, right. So, first is the pre-rounds. So, in case of pre-rounds, who will be the members of this round? Let us know. So, interns, or I think you know interns or postgraduate students. So, it means it is one hospital attached to the teaching that means the medical college or medical institute, right. So, interns or the postgraduate students perform a daily review of patients in their unit or round. So, it is coming under the pre-rounds, right. Then learning opportunities to familiarize themselves with the cases, because they have to know what are the types of cases, they are the future doctors. So, they will learn from the word round, they will get the opportunity, to learn and to be familiar themselves with the type of case, right. So, they will get variety of cases by these word round, right. Then trainee clinical pharmacists may join the intern or postgraduates in their pre-round and complete the patient medication and clinical review, right. So, the trainee clinical pharmacist, it may also join that intern and postgraduate students in their pre-round and complete the patient medication and clinical review. They will go through what are the things the patient has been taken and what are the things he has to she has to take. The patient that means what is the now, what is the condition, what was the previous condition, likewise they will take care of all these things, right. So, next what is there, that is registrar or resident rounds. So, in case of registrar or resident, that is here the registrar of that hospital or resident individually or in a team, they may go together, but in there may be chances of individual visit, right. So, the registrar or the resident individually or in a team conduct ward rounds at least once a day at a fixed time, right. So, these rounds are for what should be the purpose? These rounds are extensive and may also involve the clinical teaching to the medical postgraduate students and interns. That means, it is again coming under the teaching and useful rounds for the clinical pharmacist also of all levels of experience to join this particular round, right. So, next type of ward round is the professional and the unit chief rounds, right. The professional and unit chief rounds, in which the unit or ward chief conducts the round together with their registrar, residents, postgraduate students and interns for all the patients under their care, right. So, these rounds are extensive and address more complex issues regarding diagnosis and management, because you can see here all the things, the professional, it is a professional round, the registrar is there, the residents are there, the postgraduate students are there, the interns are there. So, here the extensive that is you may consider it as one extensive round in which all these diagnosis and management of that particular disease will be considered and will be discussed, right. So, these rounds may be more challenging for the clinical pharmacist in terms of their clinical knowledge, because in this round there will be total review of the diagnosis, management of that particular patient condition or the disease condition, right. So, it is very much challenging, it is that means you may say challenging, or you may say that it is also one way to learn, okay, by the clinical pharmacist. Then last is teaching rounds, that in teaching hospitals, academic medical staff conduct bedside clinical teaching rounds for the residents, medical postgraduate students, interns and the medical undergraduate students also. And it is conducted few times a week, right. And so, this round provides opportunity for pharmacists to improve their clinical knowledge. It is also beneficial for the pharmacists. So, what should be the preparation for pre-round? Prepare adequately before the participation in that particular pre-round preparation. So, what should be there? Accurate and up to date information on the patient's health status, the disease management and the medical and medication history is very much essential for the active participation in clinical decision or any type of decision we are going to make. So, for that accurate and particular type of up to date information is essential for that particular patient, health status, the disease management, how to manage that disease, medical and medication history. And review of the medication chart and case record is also one important aspect for this pre-round preparation. And another thing is that the clinical pharmacist, what is here? The clinical pharmacist may maintain individual patient profiles for summarizing information relevant to that patient's drug therapy, because I told you they will that is take care of the safety of the patient, the improvement of the patient, the cost of the patient, right. So, they have to, sometimes it happens that it is a good habit, you may say, that summarize the information relevant to the patient's drug therapy. So, if any issue may arise that need to be clarified by the referring appropriate information, resources must be there, right. You may go through the literature or any case report, right. Then a pharmacist intervention is mainly you may we should know what is pharmacist intervention, because if this word is coming. Pharmacist intervention is defined as any action by the pharmacist that directly results in a change in the patient's management or therapy, right. Pharmacist intervention, it is for the benefit of the patient, that is we can define it as any action by the pharmacist that directly result in the change in the patient management and therapy. If there is safety issue, then it will be changed. If there is efficacy issue, that it will be changed, right. So, the opportunities of the intervention may arise during various clinical pharmacy activities, including medication history review, medication chart review, right. You will also come across all these things, therapeutic drug monitoring and provision of drug information, right. So, how what is the next thing is that ward round follow up, it is also essential part of ward round. So, the clinical pharmacist often may encounter issues during ward round which may require the follow up, it is very much essential, right. Pharmacists should prioritize these issues according to their urgency and relevance. Which patient condition is urgent to be taken care, we have to take it in priority basis, right. So, for example, responding to inquiries, communicating information, completing the documentation, altering the patient care plan, etc., coming under this. Then role of the pharmacist in ward round, let us know what is the role. So, the pharmacist being an expert in the matters of drug related things should be available for the ward round team to decide upon the matters of dosage regimen, which will now after this we will discuss. Then formulary interpretations, adverse drug reaction, drug drug interaction, drug food interaction, drug and poison information services, all these. So, the availability of the pharmaceutical services definitely enhances the accuracy of the treatment, patient safety and the efficacy and management of the disease, right. So, let us know what is our duty. So, duties of the pharmacist in ward round, that is the pharmacist in ward round should take to 2 times, right, 1 to 2 times, right, with the doctors and another one with himself alone, right. So, in the first ward round follows the treatment given and checks the formulary for the dose prescribed, right. And further he may also critically think any possible risk to that patient due to drug administration, he will alter the team for its prevention. So, in the second round what he will do? First round he went through the medication with the doctor and he discussed something, and after that he came to its chamber and analyzed all these things. In the second round the pharmacist targets the patients prior to discharge and advise the patients regarding the discharge medication practice, right. So, what is the importance of ward round participation? That is, withdrawal of the pharmacist from the ward round will be a great job, right. If that means it is a great loss. If we will eliminate pharmacist from the ward round, it will be a great loss for the clinical team and the patients, right. The medication errors, incorrect dosage can bring down the therapeutic outcome in a negative perspective. If the clinical pharmacy will not be there, what is our importance? If we will not be there, then it is not of importance, right. And it is well established that the expectations from the patients does not stop at the clinical cure, but for a cost effective economic expenses with improved quality of life. So, the gap in the knowledge of healthcare practice in disease management can be fulfilled only by the qualified pharmacist in a hospital, which you will do, right. So, as a pharmacist, we have to get better knowledge about the adverse drug reactions, about the drug-drug interactions, about the efficacy, about the therapeutic profile, and also about the pathophysiology, so that we can only analyze what is the drug medication is going on and what is the thing that is what is the kind of improvement it is happening in the that is patient. Okay. So, as I have not introduced initially, as I am also a pharmacist, I am Dr. Sanjita Das. I am working as the head of the department pharmacology at NIT Pharmacy Institute, Greater Noida. And so, I will from myself I will suggest all you that for it is very much important aspect to know word round, because by this you will know your importance in the hospital, right. As a pharmacist, we are to decide what is the condition of that patient, because always I say that we are the priest between the patient and the physician. So, you will take care of the patient and you will notice that if there is any adverse effect, you have to that is notify it to the physician and the higher authority, and what should be the next step to be taken, you can also suggest, right, for the betterment of the patient, and that will benefit the management of the disease, as well as and if we will discuss about the financial part, that pharmacist also can suggest better treatment with lesser cost, and the hospitalization cost, everything, it is very much important for the pharmacist to decide and to know, right. So, all these aspects are there in word round, and in next lectures we will discuss rest of the thing. Thank you so much, dear students.